This is the Fertility Friday podcast, episode number 72. Welcome to the 72nd episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. So one of the most common questions that I get from listeners is how long will it take for my period to come back after coming off of the pill or other hormonal contraceptives? So I decided to create an awesome resource that tackles this tough question. And it's free when you sign up for the Fertility Friday newsletter. So make sure to head over to fertilityfriday.com/ebook to get your free copy of my new ebook, Where the Is My Period? 5 ways to restore your menstrual cycle health and fertility after going off the pill, where I reveal what to expect when you come off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. And if you've been enjoying the show, I would love it if you take a moment to leave a review and a rating on iTunes. It does help the show to move up in rankings so that more people can find it. And of course, I'd like to say a special thank you to all the listeners who've left reviews already. I do read all of your reviews, and I really appreciate you taking the time to let me know how I'm doing. And in today's show, I'm very excited to welcome a guest, Angela Grassi. Angela is an internationally recognized nutrition and health expert on PCOS. She was recently named on the top 10 incredible RDs, Making a Difference by Today's Dietitian. She is the author of The Dietitian's Guide to Polycystic Ovary Syndrome, the PCOS Workbook, and the PCOS Nutrition Center Cookbook. Angela is also the owner of the PCOS Nutrition Center, where she provides nutritional counseling to women with polycystic ovary syndrome. And in today's show, we're going to be talking about the connection between eating disorders and PCOS and how to recover and regain fertility after struggling with an eating disorder. So without further ado, welcome to the show, Angela.
Thank you. I'm excited to be here, Lisa.
Well, thank you so much for coming on the show. I'm really excited to delve into this topic because I think that a lot of people would be surprised to find that there's actually a connection between PCOS and eating disorders. And so before we get into it, maybe you could just tell the listeners a little bit about your background and kind of what brought you into this field.
Sure. It actually connects into eating disorders. So my background, after I became a registered and licensed dietitian, I started working at an eating disorder treatment facility. And prior to that, I already had some eating disorder experience. I used to be a college campus nutritionist, and so I would start to see a lot of women and men struggling with their body image and their weight. So after graduate school, I was a dietitian at an eating disorder treatment facility called the Renfrew Center. And I provided nutrition counseling to women there. And it's actually when I first encountered my first patient with PCOS. And that was a patient who came to me, and she was just diagnosed with PCOS, and her doctor told her to eat an Atkins-style diet. So Atkins, most people are familiar with the very extreme low-carb diet, like about 15 grams of carbs a day, which is the equivalent of an apple. And here was this young woman who was struggling with binge eating and knowing that she shouldn't eat carbs, according to her doctor, and couldn't stop eating the carbs. And so eventually started purging and throwing up food and was really, really struggling. So it was really an eye-opening experience to meet with her. And since then, I mean, the connection with PCOS and eating disorders is there's so many factors I'm sure we'll talk about today, but they're very common.
Well, and so eating disorder is a word that encompasses quite a bit of things. So maybe you could give us a little bit of a baseline. So when we say eating disorder, I think most people are familiar with the idea, the idea. So bulimia, binge eating, anorexia, but maybe you could talk a little bit about what is an eating disorder and how is it categorized?
Sure. Yeah, there's a couple different types of eating disorders. Anorexia is obviously the one that we know, women and men who are very low body weight. In fact, they refuse to maintain a weight of 85% of an ideal body weight. They tend not to get their periods and are really scared and terrified to gain weight. And they view themselves as being a lot larger than they really are. So there's a big distortion in the way they view their bodies. And then there's bulimia nervosa, which is binging on food following by purging. And the purging could be through vomiting, or it could be other ways to get rid of the food, like using excessive exercise as a way of purging. And then there is the newest, which is binge eating disorder. And binge eating disorder is more than just overeating. It's actually a distinct medical condition that was recently recognized by the American Psychiatric Association. And what we know about binge eating disorder is that it's characterized by eating far more food than most people would eat in a similar time period. But the binges take place on a weekly basis for 3 months or more. And there's actually a study that was published in The Lancet that showed that a third of women with PCOS demonstrated binge eating behavior.
Wow.
Yeah.
That's really interesting. A third is a huge segment, obviously. So let's get into the connection then. So the research that you've done and some of the work of yours that I've read talks about this connection between PCOS and eating disorders. So maybe you could talk a little bit about that.
Yeah, sure. So there's many, many factors. In fact, I think just having PCOS puts someone at risk for having an eating disorder. So one of the main things is that PCOS is so frustrating, and for so many women, binge eating becomes a way for them to cope with their feelings. It could be a way for them to seek comfort or even to distract themselves of intense feelings of emotional pain that they just can't tolerate, that the food, is the only way to handle those feelings. But because so many women with PCOS are frustrated with their diagnosis, I think they feel immense pressure because they desperately want to lose weight. They want to maybe conceive a child and improve their symptoms overall. So a lot of women feel that the only way to do this is by dieting. And certainly we get messages from doctors that they say just lose weight and, that'll cure or, improve PCOS. So we see a lot of women who resort to dieting and cutting out carbohydrates or other food groups or eating limited amounts of food to lose weight. And what happens is women with PCOS have these intense carb cravings a lot of the time. And that's due to the higher insulin levels. Insulin acts as like an appetite stimulant. So I think that that in combination with everything going on can lead to a lot of women to binge eat and feel worse about themselves.
Mm-hmm.
And then there's other reasons. There's even just a past history of yo-yo dieting. So many women don't even know they have PCOS, and they blame themselves for their weight gain and their struggles to lose or maintain their weight loss. So a big pattern is you go on a diet, you lose weight, and those diets aren't sustainable in the long run, and they tend to regain that weight, and then they go on the next diet, and that contributes to them feeling bad about themselves. And it also teaches distorted eating. So they don't know what foods, they get really confused about what foods to eat or not.
Mm-hmm. Well, and maybe you could, because you touched on a lot of women with PCOS struggle with their weight in general, because it's all related, PCOS and insulin and weight. And PCOS is also linked to diabetes. So all of these things are kind of happening in the body. So then obviously doctors would suggest for women to lose weight. But also just in general, when women are trying to get pregnant, if you're trying to focus on health, then a lot of women make modifications to their diet. And a lot of the kind of recommended healthy dietary changes can feel restrictive in general. So for a woman who is struggling with an eating disorder, maybe you could talk a little bit about how all of these factors come into play. How can you try to work through your eating disorder and try to have healthy eating when the healthy eating could potentially trigger your eating disorder because you're trying to restrict your diet? You know what I mean?
Exactly. So the first important thing is if a woman is really struggling with her eating, is finding herself in this binging cycle, and especially if she's engaging in other unhealthy eating disorder practices like purging food or engaging in excessive exercise, that's really important that she get a handle on before she even tries to get pregnant. Because what happens is, this can be problematic in pregnancy. And it can really be problematic after she has the baby. You know, how difficult, it's such a hard time when you first give birth to a baby. Your world is turned upside down. And it's great, and it's also, you know, very, very challenging, and it's a big learning curve. And it's overwhelming. So I think it's really important that women get the necessary treatment that they need. So if they are struggling, the best treatment approach is really working with a multidisciplinary team. And that could be a dietitian who's experienced in both PCOS and eating disorders, like myself. A therapist, a family therapist might be needed, a physician, and sometimes groups can be really helpful as well to help to decrease the eating disorder symptoms. So I think it's important to address that. It's hard to do both at the same time. It's hard to try and lose weight while you're engaging in all these eating disorder practices. So the focus should be to treat the eating disorder and the distorted eating, so to help to normalize eating patterns.
I was actually just thinking about that when you said that, because of course then the focus when you're trying to get this body that looks a certain way, thus the eating disorder. But then the focus, as you said, should really kind of be on figuring out healthy eating patterns. But that's so much easier said than done. Maybe you could talk a little bit about, so when a woman does have an eating disorder, a lot of what we talk about on the podcast is how different things impact your menstrual cycle. So what are some of the ways that like binge eating and purging, or, anorexia, where you're really, with really kind of withdrawing from eating altogether, what are some of the ways that impacts a woman's hormonal cycle and her fertility in general?
Right. So for all of them, really, it puts them at a risk of having an irregular or absent cycle. Especially with anorexia, one of the core criteria, the diagnostic criteria, is lack of a period, or amenorrhea, which is lack of a period for 3 months or more. So that can definitely make it difficult to get pregnant or to stabilize hormone levels. And certainly when women, engage in the binge eating behavior, and when we talk about binge eating, what I mean by that is eating extremely fast, eating beyond feeling full, eating a lot when you're not hungry, eating in secret, and really feeling terrible and upset by the binging. So it can really have an emotional toll and can also cause a lot of stress on the body. So a lot of times with all that stress, it affects hormone levels. Cortisol levels go up. We can see that it affects insulin. The binging can definitely increase insulin levels. And that can all throw off a regular menstrual cycle.
Okay. And then for a woman who is either currently struggling with an eating disorder or kind of, she knows she wants to get pregnant and she's trying to get a handle on it and really trying to stop the disordered eating behaviors. I'm sure one of the things that she'd be concerned about is she kind of knows that it's destructive for her body. So how much damage has been done, and how can we, or I guess what could you tell her in terms of if she's worried that she's damaged her body, how do women heal from eating disorders, and does your body bounce back?
Oh, yeah. So, that's what's really great is that the body is very resilient, especially women's bodies. We handle a lot. And that we do see there is some research that when eating becomes more normalized and the symptoms decrease, so less binging, less purging, and we do see an improvement in fertility. Ovulation can be restored. There is some studies that show that the follicles, which are commonly called cysts, which are really just follicles, can actually go down, the number of them on the ovaries. And we also see that insulin levels come down. So that decreases the risk for diabetes and prediabetes. And that also helps to normalize the menstrual cycle.
Okay. And then with disordered eating, I'm not sure if you want to touch on it. Does it impact a woman's gut health? I think I read something where, if you haven't eaten really for years. And then you try to start eating, your body kind of has to get used to processing the food. For example, if you're purging, if you're vomiting, if that's how you purge, and you've been doing this for years, then chances are your body hasn't had to actually process food consistently for a very long time. So maybe you could talk about some of the challenges physically as well as emotionally when you're trying to overcome an eating disorder.
Sure. So as far as physically, when women actually do binge and purge, a good portion of that food does still get absorbed. So it's not like they're getting rid of everything. So their body is still able to process food normally. And the binging, in the purging, depending how often it's happening, but if it's just happening, so if it's not happening at every single meal, the body can still adjust to normalizing eating pretty well. In extreme cases, when the symptoms are really intense and frequent and happening all the time, chances are, need to be hospitalized to recover from an eating disorder. And when you go into a treatment facility, they'll start them usually on a lower meal plan and then gradually increase the meal plan to a healthy level for what their body needs. So it does give them a little bit of time to adjust, but there's a lot of feelings of feeling really full and uncomfortable, and that can be difficult to tolerate. But especially if you're working with a treatment team or you're in a hospital, it's a good place. That's how you recover. There's no way to use symptoms. You have to sit with your feelings. Mm-hmm. But the emotional toll is what is really hard and does persist. So when women develop eating disorders, it's usually to serve a purpose. So whether they're using binge eating to numb or to distract themselves from what they're really feeling, or they might be using food to cope with feelings that they don't know how to tolerate. If something's really stressful for them or they can't handle that stress, they might be using food to handle that. And it does give them temporary relief, but it's not a long-term substitute. Those feelings are just going to keep coming up and up. So they can keep stuffing the food down, but the feelings will keep coming up. So the real hard part of recovering from an eating disorder is dealing with that emotional component and learning different coping skills other than turning to the food to cope. So sitting with their feelings, talking about their feelings, feeling their feelings. And it's really, really hard, but it can get better. It gets really, really hard, and then as you practice it, it can get easier.
Well, and, we live in a society, we just want everything right now. And so, a woman goes off the birth control pill after being on it for 15 years with the expectation that she's going to get pregnant within a month. So for a woman who's been struggling with an eating disorder for, however long, whether it's quite a long time or, relatively short period of time, what would you like to say to her in terms of her expectations around how long, it'll take to recover, how long it'll take for her body to get healthy again? This is a process. We're talking about a team of people to help this woman regain her health. So let's talk about some kind of realistic time frames in terms of actually recovering.
Well, what we know about eating disorders is that the longer that they go on, the harder it is to treat and recover from. So women who have had their eating disorder a shorter period of time, say under a year or two, they have the best odds of recovery. And for those who are, so everybody's different. It's hard to give a time frame. And it depends on the recovery. So how well they're doing in the recovery. If they bounce out of recovery, pretty quickly within like 6 months to a year, then they have a really good chance, I think, of getting their menstrual cycles regulated and able to conceive. And it just depends. If the woman has anorexia, she might have a whole different situation than somebody who's engaging in binge eating behavior because her weight is so low that she's not menstruating because her weight is so low. So it could take months to get her weight to a healthy range. Whereas women who struggle with binge eating, it's more getting the binge eating under control and decreasing the incidence of it. And that can really help to restore hormones and improve ovulation. It could happen even as as little as a few months.
Mm-hmm. Well, and I would imagine that, so if a woman's been struggling with anorexia, for example, and like you said, she doesn't have, because you do need to have a certain amount of fat on your body to be capable of having a child and to actually menstruate. And so if it takes you months just to get a period back, I would imagine that maybe a woman's nutritional status wouldn't necessarily be optimal, even if she, you know what I mean, gets to the point that she has a period. So I feel like that's an additional thing for women who are struggling with eating disorders, because this is not something that you can just, like, you know, on Tuesday you decide that you're good and then on Wednesday you're fine.
Right. The eating disorder doesn't develop overnight, and the treatment isn't overnight either.
Okay. And so for a woman listening who has been struggling with this, and maybe she hasn't even really told anybody about it, you know, like maybe she's kind of hiding it from her friends and her family. So I feel like this is like one of those interesting questions, like maybe I know the answer, but I'm going to throw it to you anyways. But, you know, can she do this alone? Like, can she get over it on her own by reading some stuff, or what would you say to her?
Well, again, every woman is different. It depends how much she's struggling. If the binge eating isn't that problematic for her and she does read, you know, some good books, for instance, I have the PCOS workbook out that I'm the co-author of, and it's been shown to reduce anxiety, depression, and problematic eating. So if you use like a self-help guide like that, it definitely can help. Mm-hmm. But if things are not getting better, definitely I recommend working with a therapist, a mental health professional that's experienced in treating people with eating disorders, and working with a registered dietitian. We do find that the combination of the two really helps the patient feel supported so that they can make changes in their eating, and that can reduce their symptoms.
Mm-hmm. And do you have kind of any recommendations when it comes to working with a dietitian? Because I know that different dietitians have different suggestions when it comes to diet, right? Some dietitians would suggest more of a carbohydrate-rich diet, where others would suggest more, you know, healthy fats and things like that, depending on where they are in terms of their understanding of dietary guidelines. So do you have anything to say about that?
Sure.
For a woman who wants to kind of, obviously you want to eat healthy, but she's still concerned about weight, right? She wants to eat healthy, and she also wants to kind of be mindful of her health, and also wants to prepare her body for pregnancy.
Right. So if someone wants to work with a registered dietitian, I think it's important to find one that has experience in eating disorders as well as PCOS. I think that a dietitian needs to understand what PCOS is, because it's going to affect, there's a lot of other complicated factors. And I think just like there's different doctors with different areas of practice, you know, dietitians, there's some dietitians that just specialize in celiac disease or specialize in interstitial cystitis or other medical conditions. So you want to really look for a dietitian that has experience with both. And that's something that we do at the PCOS Nutrition Center, is we have experience in both treating eating disorders and PCOS. So I think, again, the treatment focus should be on normalizing the eating disorder behavior, so decreasing the binging. And that, you know, again, it just depends on how long a woman's been struggling and how frequent her symptoms are. Mm-hmm. But definitely working with a treatment team can help to reduce those symptoms, and that's what's going to help to improve ovulation and restore weight. I mean, so much if someone is engaging in binge eating behavior, chances are it is affecting their weight, and their weight is increasing, or they're struggling to lose weight. So what you find is, as women stop the binge eating behaviors, that the weight goes down to a more healthy weight for that person.
Mm-hmm. Well, and let's talk a little bit about the emotional aspects, what we touched on as well with respect to body image. I know you mentioned with anorexia, a woman or a man who has anorexia, Well, actually, it's like body dysmorphia. Like they think that they're huge when they're wasting away.
Right.
So, I mean, even if you get the eating part of it under control, how does a woman address her negative feelings towards her body?
Right. And that's where therapy can help, and that's where group therapy can come in. But I think for women with PCOS who are really struggling with their body image, and typically that, from my experience, that has been the last to go with people as they recover from eating disorders, that they still sometimes really put the emphasis on changing their bodies. And I think women in society just in general do that. Like you hear women saying, you know, I need to lose weight, that's the answer for why you didn't get this job or this promotion or why you didn't get picked for something, you know. It's so easy for women to put the emphasis on bodies. But I think it's important that we recognize that women are built differently, especially women with PCOS, that we have to recognize that our genetics determines our body size. I think we have to recognize how to be a more critical viewer of the media and the messages that the media sends to promote thinness. I think we have to be more acceptable of different body, types. And for women who are focused on the negative parts of their bodies, that they need to be doing more positive affirmations. So instead of, patients that I work with, if they say something negative about themselves, they have to say 3 things positive about themselves to counteract that. Mm-hmm. So really talking about that and recognizing it. And the scale puts so much pressure on women. It's just a number. It doesn't indicate how smart you are, how much muscle you have, how beautiful you are, what a caring person you are. So I think it's really important for some women who are obsessed with the scale to really get away from that, because I think that putting that pressure on and just putting the emphasis on losing weight can really affect their happiness and well-being.
Mm-hmm. Well, I'd love to hear your thoughts on this. I mean, I think that with a lot of things, it's not just weight, and it's not just women, but for women thinking that, this will be better when I lose this weight. Once I lose these 10 pounds, once I get down to a size 6, I feel like that's a habit. And I think that the problem with that habit is that you'll never be satisfied. So
exactly.
When you're never, I think my thoughts are that as hard and as impossible as it seems, you have to start by trying to love yourself today and forget the try. Actually love yourself today. Force yourself to love yourself today, because what happens is that if you believe that you'll be happy when you lose that 10 pounds, you're in this habit of always thinking your happiness is going to be at this magical place in the future. And then when you do lose the 10 pounds, you're unhappy with something else. And that's always this it's like the hamster on the wheel. You're just never there.
Yep, exactly.
And what you said about the media as well, I don't watch a lot of TV, for example. So then when I turn it on and I see the newscasters all made up, it hits me how made up everybody looks on TV, for example. If you're always throwing yourself in that, then your frame of reference is really screwed up. Do you ever suggest that your clients kind of take a media detox, or how do you work with your clients in terms of all those media issues and the way women are portrayed?
Definitely. And we have so much more social media. We have Instagram and Pinterest, and, there's a lot of competition. I know women see other women with, say, PCOS who are posting pictures of their weight loss journey, and this is what I looked like before, and this is what I look like now. And it only feeds that negative, body image and feeling that you're not good enough. So I think taking a break from that, really limiting how much you're engaging in the social media, or, recognizing on TV that models are, how much work go into making models to look like how they look. Mm-hmm. They can spend hours in the makeup chair, and there are some women who have shown that this is what it takes for me to look like this. Mm-hmm. And that models and magazines are always airbrushed. They are. Their arms can be shaved down to look thinner. Their cheekbones can be lifted. So what we're looking at, it's crazy. What we're looking at in magazines is not a reality. We're not really viewing what we're seeing, and it's really distorting our views and our perceptions. And studies do show that the more people look at magazines, the worse they feel about themselves.
Well, and I remember being in university and learning for the first time, like as a 20-year-old or something, or whatever, 19 or something like that, 18. But learning, that was the first time I ever learned about airbrushing. I had no idea. So I was a teenager torturing myself, looking at Tyra Banks, on YM or whatever, and she didn't have any pores. And then I would look at my own face and wonder what was wrong with it. I remember this because I thought there was something wrong with my face. But that's just an example of the impact of these things. And we don't really think about the ways that it's impacting us, and the fact that those models, their legs don't look like that. And even in movies, the joke that Julia Roberts, her bum isn't even good enough because she had a body double, right, in her movies and stuff like that.
Yeah, Pretty Woman.
Yeah, so that kind of stuff. Sometimes I think that you got to turn off the TV and go to the mall or go for a walk and look at real humans. Look at actual human beings, because human beings come in all shapes and sizes.
Yep.
And one of the things that I wanted to ask you about as well, so let's say that a woman works super hard. She knows she wants to get pregnant. She works so hard to overcome her eating disorder. She, gains weight, is getting healthy. She feels amazing. Her periods come back and her menstruation becomes healthy, and she really does great, and she gets pregnant. Then what happens? That's my question. When you get pregnant, your body changes in all these unexpected ways, and you have no idea what it's going to look like after, in terms of, stretch marks. Different areas of your body are expanding and changing and shifting. And then after you get pregnant, not only, as you mentioned before, it's a stressful time, not only because you have a new baby to take care of that requires 100% of your energy, but then your body has changed now, and now you have a new body to deal with. So maybe you could talk a little bit about what that process is like for women who have had eating disorders.
Yeah, I can think of a patient that I have now who is really struggling. She's had her baby 7 months ago, and she's back in her clothes. And I think the important thing is if you eat a healthy diet during your pregnancy, and you should work with a registered dietitian just to find out a good eating plan. But if you gain the recommended amount of weight gain, that there's a good chance that within a year you're back to your original weight that you were at, your pre-pregnancy weight. And definitely breastfeeding can help to burn extra calories and help you to get back to your pre-pregnancy body. But this patient in particular, she's back in her clothes, but things do kind of shift. She is still nursing. So when you're nursing, you might need an extra reserve of fat for the baby. And I think women have to realize, it took a whole year of carrying a baby. And that does change your body. And hopefully, you recognize it was for a good cause. And to be a little bit more forgiving to your body and to give it some more time to bounce back. And I think doing self-care activities for yourself, like taking time to go for walks and prepare healthy foods and get sleep. Sleep is such a big issue that there's a big correlation with lack of sleep and increased insulin resistance. So definitely anyone with a newborn knows that sleep is very infrequent. But I think it's important to give yourself, some time, give your body time and focus on, the other things other than just your body, that you have in your life, like your beautiful newborn.
Well, what we were talking about with the media, all women are aware kind of on our peripheral view, or if you torture yourself and actually look for it on Instagram, all these women who apparently have babies and then 6 weeks later get their body back. I feel like that is so problematic on so many levels. I feel like it's problematic because, first of all, as a woman who just gave birth, so my son is 6 months old now, I am more than I am not somebody's plaything. Like, I'm an actual human being. So my body isn't just supposed to be on display. Like, I'm not that's the first thing I have to say. So let me get off my soapbox. But you realize, like you said, like you're more than just your body. But it's so easy to say that because all women, all people, we all want to look good. We all want to feel good. We want to feel good in our bodies. But it sets up such an incredibly unrealistic expectation. And what women need for those first 6 weeks, first 3 months, first 6 months is really nurturing, rest, and like nurturing in terms of like emotional nurturing. You need like food nurturing, right? Like you actually need food to help your body restore because of what it just did. The last thing you need are these crazy expectations. But I don't know, maybe you could just share your thoughts on that a little bit.
Yeah, exactly. We see these celebrities. I remember my cousin had on an episode of the Kardashians, and they were in Miami. And one of the Kardashians, I think it was the oldest one, the Kourtney, she just had a baby, and she was going to be on the cover of a magazine. And what she was doing, they were showing how little she's eating and how much she was exercising, and she even passed out in the episode. You know, so it is very unrealistic. They're putting a lot of pressure on themselves, and they're not happy. They're not happy. That's why we see.
Was that post-baby? Was that post-baby? I don't know.
Yeah.
Okay, all right.
Yeah, that was right after she had a baby, and she was going to be on the cover of a magazine. And she was, over-exercising and eating very little, and she passed out. So it becomes really dangerous. And we see celebrities when they're pregnant, they gain all this weight because it's the first time they're able to probably feel free with food.
Yeah.
So I think looking at that and looking at, the reality, it's the people around you, your friends and loved ones that had babies, and talk about your concerns too. I think that's important, not to keep it in or feel like you're alone.
Well, I think there's so much power to that as well. I mean, if you find yourself, trying to get pregnant or pregnant or, postpartum, and a lot of your closest friends are not at that particular stage of their life, I think it's important. People always say, but, you need a few mommy friends because you need actual human beings that are going through this that you can talk to because then you don't feel so alone, and then it helps you to normalize those things that are in fact normal, that our society would tell you are not. So the fact that your body doesn't look pre-pregnancy, first of all, pre-pregnancy was before you had a baby. So your body is actually never going to look like that again. Your body will always be a little bit different. And that's okay.
Yeah.
Because you had a child. What if we, instead of criticizing our bodies for the changes, actually acknowledge our bodies? Those changes are evidence of what we've been through. And what if instead of criticizing, we appreciated the stories that our bodies are telling us about the experiences that we've had?
Yeah.
So then when it comes to eating disorders and everything we've talked about today, what are some of the ways that, either on an individual basis or as a society, what are some of the ways that we could even prevent eating disorders, or, for anyone who's listening who has a friend or a loved one who they know is going through an eating disorder or who has struggled with it, what are some of the ways that we can help?
Sure. So I think what's important is not to tease them about their weight or their body shape or looks or even make comments. I think it's important that people just avoid, in general, talking about their bodies negatively, and this in front of their children. I mean, the kids pick up on that. You hear girls as young as 5 talking about how they hate their bodies, and where are they learning it from? They're learning it from their parents who are talking bad about their bodies. So I think it's important to be a role model and practice healthy eating and not making comments. If you are concerned that a friend or a loved one has an eating disorder, the best approach, if you're going to approach them, is to use what's called I statements. So I've noticed you're running to the bathroom after you eat. I've noticed these snacks are disappearing. I've noticed wrappers under your bed. I'm concerned about you. And be prepared that they're going to be resistant and they're going to deny it. And then I think even having some options to help them, like if you're on a college campus, the college health center usually has good counselors and dietitians there to help. If you are like a parent of a child, maybe finding some resources in your area, talking to your doctor about it. I think it's important to have a variety of foods available, healthy foods, never lock up food or classify food as good or bad, and to really compliment your loved one on his or her accomplishments, like her skills or efforts, talents, or personal values, and to listen to their concerns about body shape and appearance. So I think all of that really helps to help someone if you do think that they have an eating disorder.
Mm-hmm. Well, and as you were talking, you know, when a woman is struggling with an eating disorder and she makes a decision to make changes in her life and really try to stop the disordered eating patterns, naturally, this is not just going to be like okay, I'm good now, and then like smooth sailing. I would imagine that she would have setbacks, right? Like triggers, things that trigger her. And of course, things that like times where she actually engages in the disordered eating again. So for a woman who's going through that process, what are your suggestions for when she does, you know, relapse? You know, how should she handle that?
Yeah, I think it's important to have a treatment team in place. So have those resources, the therapist, the dietitian, and to hopefully if she is working with a team that they will help to come up with a plan if she is starting to relapse. And I think recognizing, you know, that you are relapsing is the first step, and to reach out and get help. I think that's really important. And relapses are part of the recovery process, unfortunately, for an eating disorder. So it's not uncommon for women to be doing really well for a while, and then let's say there's a big stressor in her life and it sets her back. So, you know, all these are little tests in her recovery and will help to make her a stronger woman.
Yeah, because I imagine you could just go to that real negative place in your mind, you know, I'm a failure, nothing has changed, whereas a lot has changed. And so helping to kind of get through that without it meaning the end of the world, I think.
Right.
Yeah. So in terms of your work then around PCOS and eating disorders, what is one of the biggest myths that you would think or that you have experienced about eating disorders in general?
The biggest myth about eating disorders in general is that I think that people just think of it as being the anorexia and the bulimia, and they don't realize that binge eating disorder is an eating disorder, and that's the one that affects women with PCOS, I think, the most. I think that another myth is just trying to recover on your own. I think for most people, they might need some extra help, and that's okay. Some people think it's not possible to recover, and it absolutely is. And some people just think it's something that you can just stop doing. And it's not like that. It's definitely a behavior that is serving a purpose for people. So those are some myths I can think of off the top of my head.
Well, and for women listening then who identify, you know, like they have certain PCOS symptoms or an actual diagnosis of PCOS, and they were struggling with binge eating and they had no idea that it could be related, what would you want them to know, I guess, about how those things are related and also kind of what they can do about it?
Yeah, so a lot of the symptoms, like we started talking about at the beginning with PCOS, can contribute to binge eating because women have higher insulin levels, and insulin is an appetite stimulant, so it promotes a lot of those cravings, and that can lead to binge eating. So if a woman's trying not to eat carbs, like I talked about my first patient I ever encountered with PCOS, who was trying not to eat carbs but was finding herself binging on them. So that, some strategies to help is to eat often. So this means like every 3 to 5 hours, or eating 3 small meals and 2 to 3 snacks to keep insulin levels stable throughout the day. And it's also important to add protein to all meals and snacks to help fill you up and slow down the rate that carbs are released into your bloodstream. So eating often can actually help you from getting too hungry and can maybe prevent binge eating. I think it's also important that women can work on more mindful eating. So we know that people who are conscious when they eat, they're more satisfied with their meals. They're less likely to want to binge or overeat. So conscious or mindful eating involves being in tune with your body and recognizing signs of hunger and fullness. So oftentimes I'll have my clients keep food journals where they not only write down what foods they ate, but also rate how hungry they were before and after and how satisfied they were. Mm-hmm. So women can practice this at home. They can just start keeping a food journal and use a rating scale from 0 to 10. We have this in the PCOS workbook as well, and we discuss mindful eating in the workbook. But if you do a scale from 0 to 10, 0 being completely starving and 10 being the opposite extreme, like Thanksgiving dinner stuffed, really full and uncomfortable. And it's important to check in with yourself before a meal to see how hungry you are, and throughout the meal to see how full you are.
And does that have anything to do with actually trying to be present while you're eating and trying to enjoy the experience of eating?
Exactly. Tasting the food and being aware of what you're eating. So when you're more in tune with your body, you'll be able to recognize these signals more.
Mm-hmm. And something that you said earlier, to kind of not categorizing food as good or bad, I feel like this would be such a challenge, because I think this is often said when it comes to eating disorders, but if you have an addiction, for example, to something, you don't need alcohol to survive. Like, you can actually just avoid it. I mean, it's not easy, but you can. It's possible. Kind of like smoking as well. Obviously, you don't need cigarettes to live, but you actually do need to eat to live. So I feel like this is so much more challenging, because then your triggers are around you just constantly all the time.
Yep.
Mm-hmm.
It's really difficult. That's why it's so hard. I mean, and you need more, sometimes you need more than just like some, just trying it on your own. You do need a therapist or some other help.
Mm-hmm. Well, so we'll get into the final questions of the day. So we've talked a lot about the myths around eating disorders, but what is the biggest myth about PCOS that you'd like to see corrected?
About PCOS in general?
Yeah.
Well, I think that a lot of times people just view women with PCOS that are overweight that they're not trying.
Okay.
And that they're not trying to be healthy. And it's even, I've worked with hundreds of women. I work with hundreds of women every year. And some of them are personal trainers, or they're exercise physiologists or athletes, and they still struggle with their weight. So it's not about that. And I think we have to start, as health professionals, we have to stop just putting the pressure on women to lose weight. I think we have to focus on lifestyle habits that are going to be sustainable. That we need to focus on healthy eating, that even without losing weight, you can improve your lab values. And that's more important to decrease your diabetes risk and risk of other chronic diseases. And I think it's important that women, get regular physical activity, that they get enough sleep, and that they're doing other things for themselves. That all affects, stress management is a big component too, because when you're really stressed, that increases your insulin levels. So I think just thinking that, women who are overweight, that they're not trying and that they're not healthy is a big one.
Mm-hmm. Well, and what would you say is the biggest myth about fertility that you'd like to see corrected?
Well, I think that, just telling women that they're not going to be able to have children is absolutely false. So, advancements now in reproductive medicine are so great. When women with PCOS have a lot of follicles around their ovaries, that's actually a good thing, because that means they are producing the eggs. It's just growing them to be mature eggs. So I think that's a big one too.
Okay. And last question of the day. For a woman who's listening and currently on the pill, she doesn't want to get pregnant now, but she's thinking about pregnancy in the next 2 to 3 years. What advice, if any, would you give to her?
Well, I would say to not be concerned until she's, ready emotionally and physically to get pregnant. And then when she does go off the pill, there are some advancements, like I said, to help her to get a healthy period, to get a regular period. There's certain dietary supplements. There are healthy ways of eating, and regular exercise are all important to have a regular cycle. And I think it's important, though, that women take a good year, like to maybe go off the pill a year before or 6 months before and get a whole physical done and find out if she's low in vitamin D or low in iron, and really work at making sure her labs are in optimal ranges.
I think those are great words to end on. Well, Angela, thank you so much for being here today. I really enjoyed our conversation, and I know the listeners will get a lot out of it because I don't think that the connection between eating disorders and PCOS and pregnancy and fertility are talked about nearly enough. So thank you so much for being here. For our listeners who want to find... Sorry. For our listeners who want to find more about you and they want to learn a little bit more about what you do or even work with you, where and how can they get in touch with you?
Yeah, the best way is just by going to my website, which is the PCOS Nutrition Center, and the website is PCOSnutrition.com.
Okay, awesome. Well, yes, thank you so much, Angela.
Thank you. I really enjoyed it.
Thank you for listening. If you enjoyed today's show, please share it with a friend. I'd love to hear your thoughts on today's show. So head over to the show notes page and let me know what you found most helpful. You'll find the show notes page at fertilityfriday.com/72, so the number 72. You can find me on Facebook at facebook.com/fertilityfridays with an S, on Twitter at Fertile Friday, and if you enjoyed what you heard today, you can head over to the Fertility Friday Facebook community. So just go to fertilityfriday.com/community and you'll be redirected to the Fertility Friday Fertility Awareness Facebook group. If you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. Of course, leave an honest review. And make sure to head over to fertilityfriday.com and join my email list. This way you'll be the first to know when I release a blog post or a new podcast episode. And if you do have an idea for a podcast episode or a guest suggestion, just send me an email at info@fertilityfriday.com. I really appreciate all of you for taking the time to tune into the podcast and letting me be part of your day. So thank you so much for listening. And as always, until next time, be well and happy charting.